In May 2023, Independent Lives was selected by NHS Health Education England to be a part of its 2023-2024 Community Participatory Action Research Cohort, which focuses on the cost of living. Community Participatory Action Research, or CPAR, is a method of research where community members actively take part in all stages of the research process to address and solve issues that affect their lives. We surveyed 138 disabled people and carers across Sussex and asked how the cost of living had affected them and their families. Out of those 138 people, 8 volunteered to take part in face-to-face interviews with our community researchers to fully share their experiences. The rising cost of living has significantly impacted the NHS. Our research has found that it has led to several issues, including an increased demand for services, delayed treatments, and a worsening of health inequalities for disabled people and carers. During our interview sessions, we asked our participants for their views on the NHS. This is what they had to say. If there's one thing the NHS could change to help ease the impact of the cost of living on disabled people and carers, what would you say they should focus on?
It's very cliched to say, oh yeah, get medicines correct and all of that, but I think if people get holistic treatment programs like physiotherapy, chiropody, orthotics, things like that, in order to maintain their independence and, to like make them, I guess it's a bit like access to work used to be for people with disabilities accessing employment, that kind of thing, but for the NHS, in terms of like, okay, so if we provide this, this and this, then we'll expect you to do X number of hours of work, voluntary work or whatever work you're capable, to kind of pay back the system, as it were. But they're very look into this kind of neat kind of thing where they just treat the presenting problem rather than the cause. So look a bit deeper into the cause of an issue. Like, for a good example of that might be that I need hay fever medication in the summer. Now they cut that, so I have to pay for that myself now, which is quite a lot of money. But that's not the issue. But my doctor used to provide it on the NHS so that I wouldn't need inhalers. Because if I don't take my hay fever medication, I end up with breathing difficulties and need inhalers or something like that. So she was able to understand that if she put a little bit of money in up front, as it were, it saved them money later on. So yeah, it would be really good, I think, if they could focus on the more joined up and holistic approach rather than specifically kind of like, let's treat this immediate problem. And I know that happens because people have medical emergencies and stuff like that, but for people with chronic or long-term issues, there must be a way that you can treat the person from the ground up rather than just treating the symptoms. Support them to treat the actual problem rather than the symptoms of the situation.
Start making the equipment that you need for disabled people instead of paying vast profits to private companies to produce it and sell it at enormous profits, because almost every bit of disabled kit I've ever seen across costs about 5 times as much as anywhere else in Europe or America.
So, and that's just from a manufacturing point.
It's an awful big point of view. I think we should be We should probably be putting more management into the NHS, God help us, but proper people who can do it. And taking a lot more away from the private sector who just want to mint themselves money. Really, it's just, they're just printing as much money as they want.
I think the government should invest more money. I personally think they should pay the junior doctors what they are asking for, because all the hours, all the years that they've trained for, the hours that they work, the overtime they do, and it's not just the money, but it's the retention of staff is really important. So I think that they should pay them more, definitely. I don't want to be seeing a doctor who's stressed and doesn't particularly want to be there because they feel undervalued. You know, I think that the medical profession, all the professions in the NHS are, they should be valued. You know, I think the NHS is the jewel in our crown, and unfortunately I think people that earn a lot of money perhaps pay a little bit more tax and put that into the NHS.
What difference do you think more investment in the NHS would make on services and on the people that need them?
I think it would improve waiting times. I think it would improve staff morale. And I think it would be beneficial for staff and patients all round.
In what ways do you think it might benefit patients?
Well, if you've got happy staff and more staff, then I think they've got more time to spend with the patients. And I think that that way, you know, everybody benefits.
Probably better access to digital support. So if they're unable, if you can't get to an appointment because you can't afford to, finding other mechanisms that you can at least have that kind of healthcare support. Maybe look at more outreach medical interventions as well, because I know that, you know, from my experience of some of the people that I know and care about who are disabled, it's incredibly difficult for them to get somewhere. It's hard enough for me. So then could there be more sort of community outreach as well? And talking to people, but not in a tokenistic way. Obviously it's great to be here doing this. I've been asked questions many times from different things where, not necessarily just about my disability, but from a sort of work perspective of, you know, what can the NHS do to help homeless people? I've yet to see one initiative happen. So it'd be really great to take feedback and do something with it.
Mental health services, absolutely. I'm surprised still with how long it takes to get into certain mental health services. For children, it's impossible. It's quite frightening, and I actually think it's quite dangerous how slow it is to get a child into the mental health service. And at the moment, where they aren't able to do as much because their parents might not be able to afford it, and their mental health is more at stake because of the fact that they're not necessarily stimulated as much, not able to go out as much, I think it is really dangerous that there's 3-4 year waiting list just to be seen, and that's before they even assess what's wrong or how they can help. That's too long. That is dangerous. And they wonder why the suicide rate in kids is getting higher and higher and higher. That's why. And it's something I'm so passionate about. But for me, they just need to focus on that. If you can help people's mental health, it then in turn helps their physical health. And then it helps their motivation. And then they'll be able to do more for themselves in their own lives. They'll be more likely to kind of try and find work or a volunteer job, or, you know, contribute themselves and want to contribute themselves, because a lot of us want to, but we're too scared to. So if we can get that mental health side of things balanced enough, you could have so many changed people that want to do so much more for others and for themselves that, yeah, I just think it makes such a huge impact. But for me, that should be the focus. Absolutely.
Do you think there's more the NHS could do to work with people who have medical conditions to help provide better care?
I guess the short answer to that is yes. They already do a fantastic job once you get into various services and you know how that little bit of the system works. You know, like once you know that you've got to go and talk to this person to get that or whatever, and that's how you access that particular service. But there isn't this kind of there should be like more joined up thinking with because everything joins together and it all impacts everything else. So if there was like a not quite a one-stop shop, but if they just saw you as a whole person and recognised that disability isn't necessarily about getting something fixed, but if you just get a little bit of extra support with this, then you'll be able to cut down the amount of support you need with something else. And if they could just see that whole thing as a whole thing rather than, oh, I can save £5 here or I can save £10 there. And I think a good example of that would possibly be this is obviously going back when I was originally on direct payments, so like 20 years or something, and I know the pots of money aren't the same, etc., etc. I do know all of that, but I knew who my social worker was, for starters. I had a named person with a phone number and an email, and I wasn't afraid to ring her. I'd say, I'm struggling with this, can you help? Or if she couldn't help, she'd know who could.
I think probably outreach, it will depend which services I suppose you're looking at. I think all these, I don't know if social prescribers are a gateway to signpost you to other services that can help you. But if that's the case, then they obviously need more staff. The fact that I was referred to them in October last year and still haven't been contacted, let alone anything else. I've just not been contacted with them. It would seem to me that they need more staff, but it would, I guess what would be helpful is, and I won't know that until they contact me, is what they do, what they can offer. Is that on a mental health level, or is it on a physical level, or well-being? I don't know, there's times where I feel lost with the NHS at the moment. I feel like I'm not sure what they, apart from, your referrals to whatever departments I knows through, whatever those departments, it just honestly feels like there doesn't want to be a front-facing. It wants everything to be digital or via the internet, and sometimes it's so really difficult to do that. Sometimes you need a person, or you need a person. You need, it's an odd one with health, and I'm one of the people that needs a person. I need to be able to talk to somebody, not type what it is that's wrong with me or what I need, or, and I understand that, going forward and, technology and things. I understand that, but I think they've forgotten that they're dealing with people, and people need people. It's important to I don't. There's things that you do not get when you're typing things in. So if you're typing a list of ailments because you need an appointment, or you need someone to explain something, or it's not. It shouldn't always have to be that it's 111 or the NHS app or the I guess you've got to be careful not to take away the soul and heart of what you need to be to people because of expediency, because of it's it 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 flows quickly. It's a better way to do it because it may not be the better way to do it because you're dealing with people. And I feel sometimes either rushed or, byproduct even. I think it might be worse because I am disabled, because you begin to feel like that anyway. You begin to feel like, do you really deserve a place? Which is really weird.
Do you think people working in healthcare services understand where you're coming from?
I don't think they have the time to do that. I do think that there's empathy within appointments. The appointments I've had post-COVID, I do think that there's empathy there, but I don't think it does feel like the time that they have less time to stop and take time with patients. Even up to a consultant level. I've had consultants kind of rush, and then I'm needing to say, hang on, I don't understand. Or my husband, I now, well, my husband always comes with me, but now, whereas we talk afterwards, I literally turn to him within the appointment and say, do you have anything to say? Do you have anything to ask? Because there's often things that I either don't get or miss. I think the empathy is there. I just don't think a lot of the time that they have time to spend with a client, with a patient.
No, I think they're caught between a rock and a hard place. You've got to change the top before you can change the stuff that's happening down below. Unless you change the financing that's arranged for the NHS, I think they'd probably do the things that they do well, extremely well. We expect too much from these bodies to expect to fix everything that's wrong with our lives. It's got to be real about it. It's not magic money. This stuff doesn't just grow on trees or turn up in pots that you dig up in a field. You've got to work towards it, manufacture it, trade it, however you do that. But that needs management, and it's not management that can really be done by the NHS. It has to be a holistic, whole nation thing. But we don't even believe in nation anymore. And if we don't believe in nation, then what's the point?
since Brexit, getting certain medications and things like that is an absolute nightmare. And because pharmacies are now struggling themselves because the government are only paying them 2/3. So they're only actually like getting back 2/3 of the cost of a medication. They have to then wait 3 months to get the other third. So that pharmacy, if they order something new, so for example, Keppra, which is an anti-seizure medication that he has, it's about £300 a bottle. So the pharmacy will buy that. They'll have to buy that in because it's not the kind of thing they keep. That costs them £300. They'll only get £200 back immediately. Then they've got to wait 3 months to get the other £100. So I get fobbed off by pharmacies all the time. We can't get it. That's what they tell me. We can't get it. We've checked with our suppliers. We can't get it. But then if I ask for levetiracetam, which is exactly the same thing, it's just different brands, that is so much cheaper. I can get that no problem. They can get that. Their suppliers have got that. So it's all to do with money. Everything is to do with money. So, but now I have it where my son has certain medications that are part of his symptom management emergency care plan, and I might not have it in the house for a good 6 weeks because I couldn't get it. I'm chasing everybody. And then it got to the point where I just contacted the community nurses and I just said, look, I can't do this anymore. No one's listening to me. It's a battle. It's a battle that I shouldn't have to be fighting. I could tell you so many stories of different things that I've had to go through. I mean, I relayed a story to them when they came for a palliative meeting and they just couldn't believe. It was all to do with he had to have his portacath locked with this particular stuff called heparin. It's about a 3 ml little tiny glass vial like that. And I have that in my house because they do his infusions through it for his enzyme. The community nurses couldn't use the one that was in my house because it belonged to Healthcare at Home, who come and do his infusions. They had to get it through a pharmacy. So then I spent an entire day driving around to different places with a prescription for something that I already had in my house. I ended up at East Surrey Hospital and I had to beg. I had to go up, use the fact that everybody knew Archie and say, please, can you help me? Can you help me get this? And it was already in my house. So, and then the irony is I ended up with a ton of it that I didn't need. I only needed one vial, just so they could lock off just push it into a cannula that's attached to his portacath. So, it's exhausting. I had it literally a few weeks ago. I had a phone call from the receptionist at the GP surgery talking to me about phenobarbital. So they had prescribed phenobarbital. What I got was, how many bottles was it? 46 bottles of phenobarbital. I could have taken out a village with it. So it was like, all the nurses were saying to me, why have you got so much phenobarbital? I said, I don't understand the medication, so I don't know. He would have needed 250 mils as a dose, one dose. He has 300 mils feed running at 130 mils per hour. Had I pumped my son with 250 mils of phenobarbital, he probably would have aspirated on it. So I then I got a phone call from the GP receptionist saying, we can't get what's been asked for. Can he have this? And she spouts off a dosage, milligrams. I said, I'm not a doctor. I don't know. I don't know how much he'll need. She said, well, is there someone you can contact? I'm thinking, well, you could contact them. And I said to her, well, the palliative team at Great Ormond Street, can you ring them and then get back to us? I said, look, do you know what? I said, stay on the phone. I've got my husband's phone. I rang the palliative team. I put them both on loudspeaker like this, my phones, and they talked to each other over loudspeaker on mine and my husband's phones. And I just sat there looking at my husband going, I literally can't believe I'm doing this right now. Like, all she had to do was just ring the woman herself. That's all she had to do. But, no, I've got to do it. Oh, and then the best thing was that this was at 5:30 in the evening, and the woman said to me, you need to come and pick the prescription up because this particular medication has to be done on paper. It can't be sent via the computer system. And she said, we shut in 20 minutes. And I was in my pyjamas. So I was like, okay. So I had to put a coat on, my shoes on, and quickly whiz to the doctor's surgery to pick up this prescription so that I could then take it to the pharmacy the next day. And then 7 weeks later, I still hadn't got it.
If you were advising the NHS on how they should be spending money and looking at services, are there any quick wins or fixes that you think would make a difference to patients?
I think we might have gone a bit too far down the road for a quick fix, or quick wins. But I do think it's important that people feel listened to, and that it's not lip service. You know, they are actually listened to. People are, and people are accountable for what they do as well. And, I think they've got a really tough job on their hands. I don't think it's ever going to be easy for people, and especially as money is so tight everywhere. It's where's the money going to come from? The government say they put in so much money, but where does this money come from when most people haven't got money? There's got to be, and I think people always say, well, where's the money from to go into this pot and that pot, and so I don't know. It's a difficult one because I don't think there actually is a quick fix, and I'm sure they've got lots of working groups going on, and where they say they are listening to people, but I don't know. That's a bit of a difficult one.
Well, the first thing I do is speak to people whose lives my decisions affect. So actually actively try and find out from people what they're experiencing and what would make a difference to them. I think it's very easy to make assumptions as to what people, because plonking disabled people together, we're a broad group, we all have different needs, and obviously you can't cover all of that, but I think trying to get a representative cross-section of what disabled people would be more helpful for them. I would review the whole benefit system, make it so that people actually have that advocacy support that they need in order to be able to, don't assume the worst from everyone. Don't just constantly report on the amount of benefit fraud. Actually look at the number of people that aren't getting help that should get it, because you're criminalising them and making them feel as if they're lying in order to get the absolute minimum. I'd look at my overall, as I do at the moment in my work, look at my overall budget and think, what are the priorities? As a country, how much we're wasting on other things that we could be ploughing into the NHS and other health services and other support services for people that are more vulnerable, and kind of considering where's the best use of those funds. But talking to people is the main thing, and making sure that they have the information and it's accessible to them. Just plonking something on a website or something that might not be the most accessible option for everyone.
Thank you to NHS England and to everyone who contributed to our study, supported us in our research, and helped make our project possible. This project has been funded by the Workforce Training and Education Directorate at NHS England South East. For more information on our cost of living research project, including a full report, please visit our website www.independentlives.org.